Hello everyone, my name is Michael Albrecht. I'm a internal medicine and obesity medicine physician, and I will be talking to you today about GLP-1 medications. And of course, this presentation is for informational purposes only. It is not intended to diagnose or treat any disease. The information may also be outdated by the time you view it, so take it with a grain of salt and seek specific medical advice only from your personal physician. GLP-1 medications are synthetic medications that mimic a hormone our body naturally makes called GLP-1. GLP-1 stands for glucagon-like peptide 1. It's a hormone that's secreted from the small and large intestine in response to carbohydrates ingested in a meal. And it has several effects in the body once it's secreted into the bloodstream. We'll start at the top with the liver. The primary effects that we see in the liver are that it decreases liver fat content. So many people, especially people who are overweight, have excessive fat in the liver, and that fat actually can damage the function of the liver. It leads to elevated liver enzymes and can even increase the risk of cirrhosis of the liver over time. So it's important to decrease that liver fat. And GLP-1s and weight loss in general can help reduce that liver fat. Going in a clockwise fashion now over to the pancreas. So GLP-1 helps the pancreas realize it's time to secrete some insulin. Insulin is another hormone, and its primary effect is to lower blood sugar. The next organ down is the stomach. So GLP-1s actually slow the stomach emptying. So they'll make you feel full quicker, and sometimes make you not feel like eating. So if we go over the heart, we can see that there are protective effects on the heart. GLP-1 medications can actually help reduce the risk of heart attack and stroke. So another added benefit to these medications. And finally, over to the brain. The main effects for our purposes in the brain for GLP-1s are that it is a very potent appetite suppressing medication and hormone. So what are GLP-1 medications used for? They're really used for two things: type 2 diabetes. Type 2 diabetes is the most common type of diabetes where patients are insulin resistant. They have insulin, they make insulin, but their cells don't respond to the insulin. And so GLP-1 medications can be used to treat that type of diabetes. And again, that's the most common type of diabetes. GLP-1s, of course, are also used for weight management. I've listed a number of the GLP-1s that are in use in the United States in this table. On the very far left is the trade name or brand name of the drug, and then we have the generic name, how it's administered, and then whether it's FDA approved for diabetes or FDA approved for obesity. And so if you go down the list, you'll see some are approved for diabetes, some are approved for obesity. Oftentimes, these medications can be used for either, but they're only FDA approved for one of these. So, for instance, Bydureon, Victoza, Trulicity, Ozempic, Rybelsus, and Mounjaro are used for diabetes. And then Saxenda, Wegovy, and Zepbound are approved for treatment of obesity or weight management. And you can see that some of the generic names are the same. For instance, Victoza and Saxenda are both liraglutide, and they're both once daily injection. You can see that Ozempic, Rybelsus, and Wegovy are all semaglutide. Ozempic and Wegovy are both once weekly injections, self-administered injections. Rybelsus is a pill taken once a day for diabetes. And then finally, you have Mounjaro and Zepbound are both tirzepatide, and they are both injected once weekly. So what's the deal? Why are there some medications that seem to have the same drug name associated with them? So most of these meds started out as treatment, being FDA approved for treating type 2 diabetes, but later, since they were found to help with weight loss as well, the FDA required them to go through a separate approval process for weight management. So liraglutide was initially marketed as Victoza for diabetes, but the FDA approved said go through a separate process and get approved for Saxenda, which is for weight management, FDA approved for weight management. But they're basically the same drugs. Victoza will go up to a dose of 1.8 milligrams, and Saxenda up to 3 milligrams, so a little bit higher dose for weight management. But other than that, they're the exact same medicine. They're both liraglutide. Same thing for semaglutide. Semaglutide is Ozempic for diabetes, FDA approved as Wegovy, the brand name Wegovy, for weight management. They're the exact same drug. They're both subcutaneous injections once a week. I will say that the pens for Ozempic and Wegovy are different, and the dosing is slightly different. But other than that, they are the same medicine. Tirzepatide is Mounjaro for diabetes and Zepbound for weight management. They essentially are the exact same medications, and they come in the exact same pen, and they have the exact same dosing. Some people should not take GLP-1 medications. We don't recommend that people with a personal or family history of either medullary thyroid cancer or multiple endocrine neoplasia type 2 or MEN2 syndrome take these medications, because when they studied these medicines in the rat population, so rats, they found that GLP-1s increase the risk of medullary thyroid cancer, although rats do have different thyroid glands that kind of predispose them to this cancer. But nevertheless, there's this warning that we should not use these medications in humans if you have a history of either of those two things at the top of the list here. Of course, you should not use any medicine if you're allergic to it, and you should avoid weight loss drugs if you're pregnant. We also have a lot of caution. People with prior gastrointestinal disorders such as pancreatitis, Crohn's disease, ulcerative colitis, gastroparesis, gallbladder disease, and also an eye disease called diabetic retinopathy. We're a bit cautious when using GLP-1 medications. Although we have definitely used these medications in people with these things, we just have to be really cautious with their use and watch out for side effects. So gastrointestinal side effects, so side effects dealing with the stomach and the intestines, are the most common type of side effects with the GLP-1 medications. Nausea is the most common side effect. Typically what we see with the nausea is 1 or 2 days after an injection of the once-a-week injections, people will experience some nausea. Probably 30 to 40% of patients will have some of that. Some people have severe nausea and even vomiting with the GLP-1 medications, although vomiting is less common. Constipation is also very common. We, encourage people to drink water, stay active while on these medicines, as well as sometimes they have to take laxatives or stool softeners to help with the constipation. Abdominal pain can happen. Burping or indigestion is common. Of course, the medicines help you feel full quickly and decrease your appetite. So we have to watch to make sure that patients who are on these medicines are getting the right nutrients into their body. We want to make sure that you're getting enough protein intake, as well as fruit and vegetable intake, and vitamin and mineral intake while you're on these medicines. I've had some patients who just don't feel like eating very much at all, and we don't want that either. We want a healthy weight loss if we're using these medications for weight management. The medicines could cause low blood sugar, especially if used with medicines that cause low blood sugar, like insulin and other diabetes treatments. There are also other non-gastrointestinal side effects that can happen, such as headache, fatigue, dizziness, acid reflux, gallstones, and then pancreatitis should also be mentioned. The other main issue with GLP-1 medicines is that they're expensive. They can be around $1,200 to $1,400 a month for the pre-filled pens without insurance coverage. Even with insurance coverage, sometimes these medications are too expensive. And also, insurance coverage is highly variable. So whether or not your plan covers it, it's about 50-50 in my experience right now. There are also some weight management GLP-1 medications that are slightly more affordable out of pocket, although still hundreds of dollars per month. They come in the form of a solution in a vial that you have to draw out with a syringe, and that's what the picture on this slide is showing. So a little bit more difficult to use than the pre-filled pens. And compounded versions that you'll see advertised online or at various weight loss clinics around the country also typically come in this vial and syringe formulation. The problem I see with the compounded drugs is there's probably a higher risk of giving yourself the wrong dose. So we definitely don't want you to overdose on these medications. It could cause severe gastrointestinal side effects. So that's why the pre-filled pens are better if your insurance covers them. But of course, some patients will opt to do the vial and syringe formulations. In summary, GLP-1 medications mimic a hormone made in our intestines and that have numerous effects in the body. I want to mention that these medicines are very potent medicines for weight loss. For example, Zepbound and Wegovy can help you lose anywhere from 15 to 20% or more of your body weight, along with diet and exercise. So they're very effective medications. They are now approved to treat type 2 diabetes as well as for weight management. And there's one also that's used to treat obstructive sleep apnea. It's FDA approved for that, called Zepbound. GI side effects are common. The medications are expensive, and insurance coverage is highly variable at this time. Thank you.